Hello, everyone, and welcome. Love to see all these smiling faces here despite the rain. We weathered the storm, so that's great. I think we had about 56 people sign up. Doesn't look like about 56 people here. However, thank you all for being here. I really appreciate it. This is a presentation on the shoulders, common injuries. What do we do about those injuries? Do we need surgery? Do we not need surgery? All of that. So who are we? My name is Dr. Matthew Perry. I'm a physical therapist and owner of Auto-Ness Physical Therapy. We've been in Scripps Ranch for going on 4 years now. And we're just right around the corner below the New Break Church, just like I said, around the corner. And
I'm Kevin Grayson, physical therapist, graduated with my good friend Matt. So we've been friends for a long time. And again, we love serving the Scripps Ranch community. So we love giving presentations like this and seeing a big turnout. So welcome.
Okay, I like to start all of our presentations with this, okay? Who here's heard of a growth mindset versus a fixed mindset? Yeah, a few people? Yeah. So, a fixed mindset is, intelligence is static. It leads to the desire to try to look smart to impress others, right? Those people avoid challenges, give up easily due to obstacles, and all of that, okay? Whereas a growth mindset is that intelligence can be developed. We are constantly learning from ourselves and from others, okay? I hope and I know that I will be learning so much from you guys and from your questions, as hopefully you will learn from us today, okay? This also means that please feel free to interrupt us, at any time to ask your questions, okay? I want this to be an open forum. And by the way, can everyone hear me back there? Great. So let's start with me. So growing up, I played hockey and I played rugby, two very, very contact sports. This is me playing for Washington State University, go Cougs. And it was a great experience, both those experiences. However, I did get hurt a lot, okay? This is an x-ray on the right from a rugby play. I went up, someone threw the ball really high, went up to get it, and someone just buried me into the ground. And I separated my shoulder. Yeah, I see some nods here. Who here separated their shoulder, had something like that happen to them before? Yes, several of us. Kevin, even as well. And so that's my real x-ray right there. And so, I just like to show that because, I've had shoulder issues myself. But I've worked on the shoulder mechanics to get myself moving pain-free. Actually, I'm left-handed. This is the one I separated. This one's actually stronger than this side. Go figure. But if I could do it, others can do it.
All right.
What is the rotator cuff?
Yeah, so what is the rotator cuff? Anybody know what the rotator cuff is?
Something that hurts.
It can hurt, yes. Yeah. But yeah, so we'll just go to the next slide here. Okay, so the muscles of the rotator cuff. We'll pass around the models, you can kind of take a look. Rotator cuff is comprised of 4 muscles, right? So we have the subscapularis, the supraspinatus, the infraspinatus, and the teres minor. And the primary job of the rotator cuff is stability in the shoulder, right? It's to keep this arm bone, your humerus, kind of centered and stable in the joint. So a lot of times when you have an issue with your rotator cuff, most commonly it's that supraspinatus, that darn supraspinatus. But it can be any one of the muscles. And an injury to any one of them is going to reduce that stability, cause pain, and then it kind of cascades down into these mechanics issues, and then you have trouble just even reaching overhead. So we'll kind of have a couple slides coming up here that'll show some of the mechanics in just a second.
Who here has heard of the supraspinatus? Most people. So that's probably the most common tear or issue, most problematic muscle in the rotator cuff. So Very common one. You'll keep hearing it throughout the presentation.
Yeah. Okay, so this next slide is a good model. It actually doesn't have the supraspinatus in it. It has the muscles from the front and the back. Okay, so that would be, you know, your infraspinatus, teres minor, and subscapularis, but it just kind of shows these are the rotational muscles in the shoulder, right? So if you have an issue with one of these, you're probably going to have issues with rotation. And even the supraspinatus, I know it's kind of not really showing as much there, but it's going to cause a lot of issues in rotation back and forth, okay? And this is a great slide of the action of the supraspinatus. So again, it helps initiate that movement when you start to lift overhead, okay? And as you can see, you know, let's say we just take a slice in the supraspinatus there, that arm bone is going to bump right all the way into the shoulder blade, right? So we often see people, they call it a shrug sign, right? So if you have a really bad supraspinatus problem, you're going to lift up like this, and it's going to cause a lot of pain and impingement. We'll talk about impingement in a little bit, but I'm sure a lot of you have heard that word before. Any questions about that or about the supraspinatus? Yes?
You told the muscles, and my understanding was the supraspinatus was a tendon.
Was it tendon?
Yeah.
So it's a muscle tendon. It's all one. So supraspinatus, every muscle has a tendon, right? So there's an origin and an insertion. So you know, this muscle originates on the shoulder blade here, and then it turns into the tendon on the humerus. That's where it inserts onto your arm.
That's
right?
the white part right there.
Yeah, so commonly when you have a supraspinatus like tear, partial tear, or injury, it's in the tendon, which is the white part from here to here. Okay? Gray part, yes.
Whatever color that is, yes.
Gray, yes. Maybe it's the angle over here.
Yeah.
Any other questions about that?
That's a great question.
Yeah, so what are healthy shoulder mechanics? Kind of let Matt take it here. Okay, we'll get that one.
You want to take that?
Yeah.
So as you move your arm up, what should be happening is, you see that shoulder blade, that's that triangle looking thing? As it comes up, it should be moving in a direction something like this, okay? You see how it's coming out a little bit? Okay, we call that protraction. We call that upward rotation of the shoulder blade of the scapula, okay? With healthy shoulder mechanics, we have muscles that are helping assist that, okay? A few people here I've already seen when they raise their arm, they're doing this. As Kevin said, that shrug sign. A few people have already nodded, okay? Those are unhealthy shoulder mechanics. But we really need everything working in conjunction. Something I was saying earlier before the presentation to somebody was that we spend so much time looking at this shoulder joint, just the shoulder, nothing else, okay? When really it's a whole complex that needs to be working together in order for us to move our arm overhead, okay? And this is the same thing. This is called abduction. Before we had flexion, you know, when you're reaching up to get a glass of water or something like that. Out here, when we have abduction, same exact rules apply, same exact mechanics should apply, I'll say.
Yeah.
Okay? With that upward rotation of the shoulder blade, those muscles working together to help guide it up. Any questions on this so far? I know it's a little complicated, but please ask questions if you have them.
Yeah. And one quick note just about this slide and the slide before. What you're seeing here, this big muscle, is your deltoid muscle. So your deltoid is basically that definition of the shoulder. It covers up the rotator cuff, and it actually is the prime mover. So, you know, when you go to lift your arm whatever direction, most of the time the deltoid is doing most of the work. The rotator cuff, again, is helping initiate that movement and keeping your arm or your bone kind of centered in the joint, okay? So a lot of our, movement issues, if you work on deltoid strengthening, it can help a lot with the mechanics and shoulder pain as well.
Okay, so here's just another illustration, a static picture. You see how that dotted line here with the shoulder blade where it was and then where it's going to? Okay. That's how it really should be working. We're spending a lot of time on this because we feel a lot of healthcare professionals don't talk about this, right? I mean, have you guys ever heard of upward rotation of the shoulder blade and things like that? Probably not a whole lot, right? Again, we just focus here, but it's the whole complex that needs to work right, work correctly for us to raise our shoulder overhead without pain. You got one more?
Good. So again, just a great working slide that kind of shows you what the shoulder blade should be doing. And as he lifts his arm overhead, it should just continue. It essentially follows your arm, right? So my arm goes like this. My shoulder blade's trying to sit directly underneath it. And these are some of the muscles that help engage it. We have the serratus here, and then the one on the inside here is actually like your mid-trap and your lower trap. So those muscles are what we work a lot on in rehab, getting those muscles to activate and improve those mechanics.
Who here has heard of the serratus anterior before? A few people, nice, good. That's really important. It's probably one of the more important muscles, in my opinion, in our torso and shoulder blade complex.
So are those the lats down there, all that blade with the red ribbon?
Great question. So all of these guys back here are your lats for the most part. Okay.
Traps.
So, or sorry, traps is what I'm.
Did you say lats?
You said traps, right?
This one?
That's your serratus anterior muscle.
Yeah.
Yes.
Yeah.
Great question. So sorry. Yes, we have our traps back here, and but someone said lats. So
yeah,
lats are also incredibly important for shoulder stabilization and things like that. We'll talk about that in a little bit.
Cool. So this is kind of just generic pictures we kind of compiled. This is what you might see if you Google, rotator cuff tear, and then all these pictures pop up. Oh my gosh, look at that one, full tear. It's that looks pretty scary. All of these kind of give you that picture that that's a major problem in the shoulder, when really it might be a lot more minor than that. That's kind of the image we're trying to portray right there. So,
but you all need, if you don't listen to anything else we say here, you all need to understand that your rotator cuff is not a rope. It's not on its last little thread, okay? All of this is, for the most part, tendon, as we talked about before, tendon, okay? All of those muscles coming together into a tendon sheath, okay? It is not on its last thread, most likely. We haven't evaluated you guys, but it would be very surprising to see if it was like that. A rotator cuff tear is much more like a hole in the blanket, okay? So we have this whole sheath here, and we have a little hole in it, okay? Just one thing that's that might be dysfunctional. And that could cause a lot of pain. That could cause a lot of dysfunction. That could be problematic, right? But it's not on its last thread. Okay, we really want to illustrate that. Yeah. Does that make sense, everyone?
Yeah. So we really like the hole in the blanket analogy because, if you're looking at a rotator cuff that looks like that, I might not want to do strengthening exercises, right? That, it might tear that last thread. But, if we're talking about a hole in a blanket, most of that blanket is intact. So you can actually strengthen that tendon, and there is some evidence that smaller tears like that can heal just with exercise. So, you might, some professionals might have said, oh, don't do this with your shoulder. You have a rotator cuff tear, don't lift overhead or don't lift weights. But, that might actually be more detrimental than it is beneficial. So, depending on the tear, obviously, because there can be some really, significant tears, but most of the time strengthening is going to help. Okay?
Yeah, the interesting thing is, don't take it from us, take it from the evidence, okay? There was a study of 660 4 participants with they were all, what was the study? The study was the non-painful asymptomatic. Yeah, so rotator cuff tears accounted for 34.7% of all tears, and non-painful asymptomatic tears. Do we all know what asymptomatic means? No symptoms, yes, exactly. Doesn't hurt, no reported pain in that area. Accounted for 65.3%, okay? So a lot of us, even not in this room, because most people who are here have had shoulder issues, most people, have some kind of issue, somewhere, in their body, according to this study, right? Asymptomatic tears are twice as common as symptomatic tears, okay? And prevalence of rotator cuff tears in the general population was 22.1%. And that's just surveyed, right? That is just people who signed up for this study. And an interesting thing was a few years ago, the American Academy of Orthopedic Surgeons. You know who they are? Yeah, exactly. Exactly. The governing body of the people who did your knees. They stated, thus, the presence of a tear in and of itself is not clinically significant for many people as they have no pain or apparent lack of function. Okay? These are the people who cut, and they're saying maybe we shouldn't cut as much or think twice before we cut. That's pretty profound in my opinion, right? The carpenter wants to carve, that whole saying. So, and this isn't for everybody, and there are exceptions to every rule and all of that, but a lot of people might be dealing with stuff and not have pain. Other people are dealing with it with pain. That doesn't necessarily mean operating is the first thing we do here.
Can you go back and show us which injuries are most commonly related to swimming?
To swimming?
Yeah.
Well,
What gets injured more often?
that's hard for me to say, but I would probably say it is the rotator cuff and, dealing with some impingement as well. And we're going to talk about impingement in a little bit. Does that answer your question?
So which part of the rotator?
Well, like we said before, the supraspinatus is the most commonly injured tendon of the rotator cuff.
Oh, I see what you're saying. Just go back to maybe a picture. I see.
You want to see this picture?
Yeah, something like that. So I think for understanding the question, right, because I agree with Kevin, I think rotator cuff is probably one of the biggest things for swimmers that they need to be aware of. And so typically it would be this supraspinatus tendon. I actually don't have any research off the top of my head regarding swimmers and where tendon is, but they have these really, really developed backs, but most of it is down here, not necessarily the supporting musculature up top. That's kind of anecdotal, but.
What about golf?
Golfers in the shoulder?
Yes.
Yeah, well, it's not golfer's elbow because that's the elbow, but the shoulders are less common, but it is still the rotator cuff. And that's because we're getting up into that overhead motion. So similar to swimmers, in your backswing, you are getting overhead above 90 degrees, which is where we start to get more impingement in the shoulder, and these structures kind of start to get damaged or can get damaged, right? Because you're going above overhead and then you're doing a lot of force through the ball, okay? And similar to swimming, you're overhead and having a lot of force come through, where if there's even a little bit of mechanical issues, it can start to wear down on the rotator cuff.
I'm starting to see a pattern though in sports, overhead movements.
I'm just thinking in swimmers, it probably is overuse.
Yeah, absolutely.
Yeah.
Yep.
Mm-hmm.
Yep.
It's the same exact thing.
Over and over again,
Yeah.
no matter what stroke you do, I would say the best thing, or I think I read something, and it was like the least injured one is the backstroke because the mechanics are just a little different. For maybe, yeah, exactly. But, oh, sorry. Sorry?
You were saying they were or something else.
Oh no, I was just saying the backstroke is, probably one of the least injured areas, at least for the shoulder, out of all the others, out of all of the strokes.
Yeah.
That was a great question. Yeah, thanks for asking. Yeah, we're going to cover some golf and some pickleball and some tennis in a minute as well. But first, we got to get moving a little bit, right?
All right. Yeah, so we'll get moving a little bit. Just going to do a few exercises for the shoulder. These are pretty, intro basic exercises, but please, if anything is painful or uncomfortable, don't do it, or maybe ask us a question, because we want to, obviously give you some tools, but don't want to injure anybody with these exercises. So don't force through it. But they're pretty basic. So if everyone's okay with standing up. Okay. So the first one we're going to do is a little bit of rotation.
And I'll come over here so I can,
but also
you guys can see
a squeeze of the shoulder blades, okay? So you're gonna be here and rotate outward and squeeze your shoulders together, okay?
Guys, I'm
hold
over
for about
here.
3-4 seconds and then back,
So you can see
okay?
me.
And then let's do about 10 of those, okay?
Shoulders
Really
down
squeeze
and
back.
Pull.
Good.
Good.
Okay?
Is the purpose of stretching?
So this is an exercise to kind of work on rotation, but also
Yep, like
activation
that. So
of
what
your
you wanna make
muscles
sure you guys
between your
do
shoulder blades. So I want you to
not
feel that
doing this
squeeze
with the
back here.
All here.
So
I'm trying to
squeeze
pinch
them
my shirt
together.
in my shoulder blades. You kind of see that?
Okay?
There you go. That was good. That was good, sir.
So you feel at what part of your shoulder?
Remember my touch?
Okay. Keep your elbows tucked in a little bit more.
There.
And
You're
think
kinda
about
coming
your
up.
shoulder
I
blades
want you
coming
pulling
together.
back.
Okay? Good.
Exactly. Don't raise your shoulder blades. Mind it, sir?
Everybody feeling that squeeze in the shoulder blades?
Pinch from there.
Good.
There you go. That's
Again,
pretty
this is
good.
one we
Yeah, just
typically
keep
will
this quiet
add
up here.
resistance or
And
weight
then again,
to.
make
Right?
sure
It feels
you
pretty
have your abs
easy just to
engaged,
squeeze, and it's
ripping
good just to
yourself back like
squeeze.
that.
But ideally, if that's simple, we want to add some resistance. Feeling some discomfort there? A little bit? Yeah. Is it when you rotate outward? Yeah.
It's
Down the
Were you
arm.
able to do this? Well, that's
So often that is
that's
referred pain. Referred pain. So it still is
Um,
probably from the rotator
no, I mean,
cuff,
it's very person specific.
but
I
the
mean,
pain will actually kind of
we've worked
travel
with
down
people
the
who've had
arm a
complete
little bit
tears and they've
because
restored
that's where the
function.
muscle
There's other
kind of
people who haven't.
refers the pain to.
Someone like Hans, who's one of our clients, has
Yeah. Yeah.
well, it doesn't repair itself.
Everyone good
However,
with
you
that
can
one?
strengthen the adjacent
Good,
muscles
good.
to
How's
it
that one feel
and
on that
restore
shoulder?
some motions. I'm not making promises, of course, but
Good. Yours is up here.
yeah, just stick with it. If anything hurts, don't.
Well, we'll be careful with it the next couple, okay? All right.
What we got next?
Yep, everyone good with that one? Okay, next one. This is one of the best exercises for your supraspinatus, so that main rotator cuff tendon and muscle. They call it the full can exercise. So that's because that you imagine holding on to a can and you're just lifting up, just to about 90 degrees. So think about a
Kind of
45-degree
out here.
angle. So not straight out in front, not out to the side.
That looks
And we're just coming
good.
up and back down. Okay?
And just, again, try not to
Yeah.
shrug your shoulders, okay? You see how,
So
although
straight
I'm going
arms
up and
here
down, my
is
shoulders
preferable.
aren't changing.
Again, feel those shoulder blades kind of squeezing
It's very
down
hard to
and
do.
together
It's
as you lift.
retraining your body
Okay?
how to move and how to work.
And this is, again, one we commonly will add weight to. But you want to watch that you're not shrugging your shoulders up.
With the weights? Yeah. And so here, if out here is
Good.
painful,
Everyone okay with
you
that
can come
one?
back
Any
in a little
issues?
bit. But this should be relatively pain-free for even people with shoulders.
Good.
That one's, yeah, you don't want to be out here. So
How'd that one
looking
feel?
around.
That was okay?
it shouldn't.
Yeah,
And that's
you've done
actually
this
what I was
one before?
telling them over
Yeah.
here.
Okay.
Is we need to make sure that we're nice and grounded and our
Yeah.
abs are engaged as we're coming up.
Yes.
Otherwise, we're going to do
Good.
this.
Good.
Okay, there's going to be a lot of back stuff. So no, it shouldn't hurt your back. Why don't you give me a couple?
Okay. How's that one feel for you?
Is that okay?
Good. Good.
Feeling your back? Gotcha. Okay. So that's
Yeah. So if you have a little bit of bicep
it sounds like it, yeah.
irritation with
Yeah,
that,
so
you
so that
might
may
feel
be
it.
something you might want to
But
avoid.
again, it is
It's
extra
something like
important to
we can
feel
talk
those
after.
squeezes.
Yeah.
So the more you're kind of here with
Not
that,
doing any
if
of
your
this, like
posture's not
none of
great,
it. Like
you're
I
gonna
shouldn't
load
be.
way into those
The
structures
only thing
more
that's
than
moving is
being
my
up here.
arms.
Yeah,
Of course,
good
great
posture.
questions.
Okay, everybody ready for the next one? So this one's a little bit different. We're going to be in that overhead position. So, be mindful if you do have pain here. Let's maybe hold off on this one, but you're going to be up in that overhead position, and then think about doing a figure 8 on one side, okay? And then let's try the other side, okay? But try to be all the way
So if we
overhead.
can,
No shrugging.
like this, and
Okay.
then just that figure 8.
Like a composer
this.
right there. That's what you got.
You're kind of doing that. It's fine.
Good.
This is all coming from the shoulder joint.
Yep, so try to be fully extended if you can. If
It's
not,
kind of difficult, right?
maybe we have a restriction in mobility.
Guys, up here at the end range, whatever your range is, try to keep everything else quiet, and then just give it this figure 8s. It should be coming, if you don't mind my touch, it should be coming from about here.
You got the 7.
So kind of that.
Let's feel okay. Very good.
You kind of feel that?
Yeah.
I couldn't get the 8, but you get what I mean.
Yeah.
Yeah.
Yeah,
We're not
that's awesome.
we're not
That's
doing
amazing.
this.
Good.
It's all
Everyone
from the
okay with
shoulder
that
joint.
one? Okay. So the last one we're going to do
Straight up here as high as we
is
can
actually
go.
a great alternative.
Yep. And then just on one side. Yeah, and then you can go to the other side.
So pretty typically with intro exercises like that, if we're not doing a lot of weight, we'll do sets of 10 to 15 repetitions, maybe 2 to 3 sets, okay? Again, if those were pretty easy for you, we could always add resistance, but that's kind of just the next step there. The last one we're gonna do is a good alternative if anyone had pain, like reaching overhead, or felt themselves shrugging or struggling to get up there. So this one we call wall shoulder flexion. So we're gonna have to kind of maneuver around a little bit and look for some wall or window space. And we're essentially gonna come here and we're gonna slide up the wall as far as you can to get a big stretch, okay? And then we wanna do that without shrugging up, okay?
You can try an invisible wall. Actually, so we were talking about that serratus anterior muscle, and part of this is actually activating that by gently pushing
great
against the
stretch.
wall. Slightly. We're not going through the window.
Yeah.
I can do all those things, but I can't go fast.
Isn't that wild?
It's tough on this side, huh?
Yeah. So
All this,
yeah.
It's at a
Yeah.
Bristol Ladder Gym.
Yeah, there's a lot of things that
ladder
can be
jack,
done.
okay.
It looks
Yeah.
like you'd be a candidate for some good joint
How long ago was
mobilization
that?
and some soft tissue work to try to release that. So
42 years.
Oh, okay. So it's been a while.
let's talk after. I think there's
Do you
some
feel
things that can
just trouble in those end range positions?
Yeah, it's a small push,
It just
ever
doesn't
so
go all the way
slightly
up.
against the wall as you come up.
Yeah. Okay. You feel pretty strong though? Pretty good? Yeah, down here, just up here and stuff.
moving too abruptly or moving more weight
Yeah.
than you should, would it flex out?
Yeah.
It can happen over
that's
time.
kinda
Most
next
tears
step if
aren't
that,
very
if
abrupt.
things don't work out.
They're
right,
gradual,
but,
very gradual.
um,
It's gradually. I like to
Yeah.
think of it.
Oh,
I
yeah.
can talk about it later. Is kind of picking a scab, and every
Yeah,
time you're
'cause it's
doing it in
been
a
kinda-
certain way, you're picking that scab.
Yeah.
You mean if it hurts or if you're not aware of it hurting?
If you're not aware of it hurting,
Yeah,
then
so-
it turns into it hurting,
Yeah.
and then you are aware of it, right? But it was most likely happening way before.
Because they
you
reversed
ended up
the
feeling
mechanics
pain.
of the
Does
shoulder,
that make
right?
sense?
Where instead of like this, then they reverse
For
it.
many of us, you know.
Yeah, it's a big one.
Mhm.
It's a big one. Yeah. Yeah.
What about
If you have
the
any
years
questions,
at
just,
whatever
feel
job
free.
you were at, sitting in certain positions and postural? You know, I mean,
When you put
kind
it
of
up
get what I
there?
mean. There's a lot of other things that build.
Yeah.
So,
Even the second.
but that's a great question. You can ask it again in a minute. So
It's more that end range
Let's,
kind of movement. Yeah.
So you say those will increase the blood flow, exercises like that?
Yeah.
All right, everyone, let's find our seats.
Like that full can exercise. you know, that's a great supraspinatus exercise, and that will, you know, start to get that tendon to heal and improve its ability to contract. Yeah.
How'd all that feel? Hard, awesome, good, bad. Yeah, and it's not always strengthening. It's you know, because we're not although we say buff cuff, have a buff rotator cuff, you know, it's really improving that brain body connection. Okay, making sure that when you tell it to do this, it's doing this as opposed to doing this or some of the other things. Okay, we're not necessarily saying that, you know, this rotator cuff is going to be Arnold Schwarzenegger, but it'll work better together. The system will work better together.
What if you have a small area of rotator cuff? Does it heal on its own, or?
As Kevin was saying, yeah, they can. They absolutely can. There's been some research that says that although people become asymptomatic, aka not having pain anymore in their shoulder, there wasn't anything that changed in the rotator cuff. But they didn't have pain. They could do all the things that they wanted to do. And as I say, who cares what they see on the autopsy for me? They say, oh, he had horrible arthritis or whatever. You know, as long as I could live my life pain-free, that's the important thing, for me at least.
Lighter weights, more weights, no weights. How can we encourage it to heal if we're having a
A lot of exercises like this, you know, figuring out specifically what's going on with your tear, because your tear is partial tear, different than your partial tear, different than yours. Okay, coming up with a periodized and specific program for that, I think would be, you know, a good step in the right direction. If you're not already doing that, of course.
Yeah, and that's a great question. Again, we have, you know, our two different types of tears, whether or not they're large or small. You know, we have degenerative and we have traumatic. So obviously traumatic is I fell on my arm and then, you know, it tore. And those are usually the larger tears. The degenerative tears are these repetitive use injuries or repetitive strain injuries. And impingement is one thing that causes a degeneration of the rotator cuff. So if you have, you know, a mobility restriction or your mechanics are off and you're always, you know, swimming or doing these overhead movements, over time, that tendon of the rotator cuff, usually the supraspinatus, starts to wear down slowly. And, you know, you might, oh, my shoulder's kind of sore. And then, you know, it goes by year after year until finally it starts to turn into a bigger tear. Now, like you mentioned, that can be, you know, ideally reversed partially with exercise, but we have to figure out how to reduce that impingement with improving the mechanics. So that's why we really harp on mechanics of the shoulder. Okay. Any other questions about that?
Great questions. We love the interaction.
So impingement. Who knows what impingement is? Or what is pinching? What is impinging in there? So the one on the right is essentially what is impinging, and it's usually the rotator cuff. So there can be a number of things causing impingement, but typically it's the supraspinatus getting pinched on this little bone here, which is what we call the acromion. That's on your shoulder blade. So the supraspinatus actually goes right underneath it. And in normal mechanics, you can't see the supraspinatus there, but there should be enough space as you lift that it doesn't pinch. Okay? Things that can cause it, even being tight in this muscle here, the infraspinatus, if that muscle is tight, it can kind of pull you into a position where it's gonna pinch. So, you know, I've had patients in the past who have had impingement that it was cleared up just by working on stretching and mobility of the infraspinatus or the muscles on the back of the shoulder. Okay, so it can be mobility, it can be a mechanics thing, it can be a number of things that can be, you know, fixed with these types of exercises. Okay?
What was the main cause of that impingement? Main cause.
So, you know, clinically, I would say from what I've seen, it's usually a mechanics issue. So something is, you know, you're not getting enough rotation of your shoulder blade, and then it causes that little bit of a shrug. And even if it's a minor shrug like this, you can start to get pinching of that tendon underneath the shoulder blade. Okay, so
it's usually the back muscle here.
it can be, well, it can be any number of muscles. So I'm saying it's usually the supraspinatus is what is impinging.
Right.
Yeah.
But
Yeah.
caused by.
Yeah, tightness there, or weakness in those muscles we looked at earlier, right? So we have the serratus anterior and the mid trap. If those muscles are not actively engaging or they aren't as strong as we'd like them to be, your shoulder blade is not going to upwardly rotate enough, and that alone causes impingement. So that's, again, why in rehab we like to focus a lot on strengthening of those scapular muscles.
So impingement's the reason I teach yoga.
Yeah.
And you'll see a lot of people where they go like this.
Mm-hmm.
And that's
Yeah. It could be weakness as well, but typically it's impingement, right?
I just want to be able to say, hey, I try to tell people to relax.
Yeah.
Yeah.
Shoulders down and
Yeah.
back. Mm-hmm.
Yes. And just think of widening a little bit.
Yeah.
But what can you do to help make that go away? Just like in a yoga class, or just stretching, shoulder stretch.
Right. And so that's where, again, we love that people are taking the steps to actively kind of work on reducing the impingement. And sounds like you're helping a lot of people with yoga and doing that as well. But, if these things aren't working, that's where it's time to go see a professional, see a physical therapist, and, really get your shoulder evaluated. Because, is it a mechanics thing or is it a mobility thing? It could be both. It could be either one. Okay? Great question.
The graph on the left, it shows the bone going up as you move your shoulder. On the right, is that a different bone that doesn't move when you're moving your shoulder?
Yeah. So, sorry, we should have clarified this a little bit more, but on the left, we're talking about normal mechanics of the shoulder, and on the right is when somebody has impingement. So that shoulder blade, again, is not moving, and that humerus is kind of bumping up into the scapula. And that's what's causing that impingement and pain. Does that make sense?
Someone was just talking to me while we were doing the exercises of like, oh yeah, I can do this just fine. But as soon as I do this, you see what I did there? That's that fixed shoulder blade, that shrugging thing. He's trying to create the motion by doing this, which is then going to cause this to try to get high. And that's just how the body compensates, right? But we should think of it, or how I think of it is every time we're doing this, think of it as picking a scab, okay? When you have a cut or something like that, and and it scabs up, and you pick it, guess what? It's not going to heal, correct? So every time you're doing this, you're doing possibly more, not good than good for your shoulder, because you're further picking that scab in the rotator cuff tendons, okay? So that's why it's very, very important that we restore that motion. And sometimes that needs to be through manual techniques where we need to put it in some different areas, joint mobilizations and things like that. Yoga even, is great, as long as you're keeping that long neck and, all the positions. But you need to do something about it because it's likely not going to get better on its own.
Great. Long neck.
Yes, this is more of a Pilates, I think, term. But yeah, keeping a long neck. So if you're doing sit-ups and things like that, well, how do most people do sit-ups? How should we do sit-ups? Here, okay? Obviously on your back, okay? Keeping a long neck. Because what's this? This is a short neck. This is a long neck. This is where we want to be. This is where we probably shouldn't be, but maybe some of us are. Does that answer your question? Yeah, of course. Hey, so who here plays or has played pickleball? Fastest growing sport in America, I believe, right now. What about golf? Plays or has played? Gotcha, a lot of hands there too. And tennis, I don't have tennis on here, but tennis, okay, gotcha. So, at least golf and tennis, a lot of overhead movements, a lot of that, okay? Pickleball can get up there. Motion's a little different, but it can still stress the rotator cuff in ways that we don't want it to, that maybe it can't handle. Okay, that's what I was asking before. You know, do you start to see a pattern with golf, right? With tennis, and you know, like I said, pickleball, you can kind of get up there as well. So these swimming, these overhead movements repetitively can be harmful for our shoulder. Obviously, there's professional tennis players who have never had any issues in their shoulder. Okay, they train their rotator cuffs a lot. Same with Michael Phelps and all the swimming people, as well as professional golfers. It's not putting up 225 pounds over their head or anything like that. It's mobility and stability, brain-body connection.
Cool.
So, you want to do it?
Yeah, so we just want to show a slide here. You know, this is kind of what we call upper cross syndrome, but basically the points I want to make here is that is posture. Posture makes a huge difference in, you know, how you know your shoulder moves and your shoulder mechanics. So typically when we have tightness, it's going to be in those muscles up here, upper trap near the neck. And in addition to that, we're going to have weak low trap and serratus anterior. Remember, those are those two big muscles we talked about that are really important for upward rotation of the shoulder blade. Okay, so typically someone who has upper cross syndrome, you know, we're going to see this kind of posture, right? So we're maybe someone who has a desk job and they do this all day and then they just have trouble getting out of that position. Okay, and then on the next slide, we'll kind of show, you know, what that looks like in regards to your shoulder mechanics. Okay, so if I have good posture, I'm up tall, I can get up pretty high, as you can see in the first picture. Now, if I kind of roll my shoulders forward and then I try to lift up, I can only get this far, right? So that my shoulders are not upwardly rotating. These muscles are limiting the ability for me to get overhead, okay? And if I try to force through it, that is going to cause impingement. And if I just keep doing that, so imagine if you're here and you're trying to swim all the time. Again, it's kind of picking that scab, like Matthew said. So, any questions about that?
And just real quick, just for a couple reps, if it doesn't hurt, please don't do it if this hurts. I'd like you, if you can stay seated, that's fine. I'd like you to have a nice upright posture. See how far up you can get. Good.
Good.
Great. Okay. Hands down. And now round your shoulders at like 5 o'clock position on a Friday for me at least. And try it. Yeah. It probably feels uncomfortable too.
Yeah.
Right. And so that's just a, you know, huge
Yeah.
illustration, you know, of it. And most people aren't like this, right? You know, you guys are just like this. So
yeah,
it's just important to recognize. Stop slouching. Yeah, this is the other thing. I was correcting some people back there. If we don't have the motion because our shoulders are forward like this, guess how we're gonna guess how we're gonna compensate? Because we're still gonna reach the ceiling. If I tell everyone to, you know, raise their hand towards the ceiling, you're gonna do it, but you're gonna do this. See what's happening in my back? This is how shoulder pain can cause back pain. Who here has back pain? Or has had back pain at some point? Yeah. Huge correlation between shoulder and back and shoulder. So. I think what we'll do is we'll talk about the snow angels. We've already kind of done some scap squeezes. We're going to do them in a different way, but we'll do this for now.
Yeah.
And then some neck stretch. We can stay seated here. Want everyone getting in their best posture, please. Okay. Watch your neighbor next to you. I'm just going to demo this. Yeah, you're in a good spot over there. I'm going to demo this, and then I'll do some modifications. Okay. What we're going to do is, as best as we can, do this. Okay. If there's people around you,
bend the elbow.
keep your arms bent.
Yeah.
Okay.
Remember,
Pull back like we did with the scap squeezes.
Good posture.
You don't have
up
to stand, it's
tall.
fine. I just wanted to show you guys a little bit about this, this exercise. Okay, good posture, perfect. And come up and down. So many of you, if you can see me from a side view, are doing this, almost like the breaststroke, talking about swimming. Ideally, we're in a straight line up and down. Okay, that's ideally where you want to get to. Yeah, a little bit of pain. Okay, you can guys can just relax. Any questions on that snow angel exercise? There's a lot of different ways you can do them, but again, just a quick couple minutes. Some of these, you know, hopefully over time, you know, the shoulder will start feeling a little bit better. Okay, but ideally, you know, you want to try to address your problems as soon as possible. Cool. Yeah, we can.
Cool. And then I'll just make a quick note on the self-stretch to neck muscles. Just like he mentioned, long neck, you know, the neck muscles have a lot to do with the shoulder mobility. Most notably is your upper trap, which is where a lot of us hold tightness and tension and stress. So those are these big muscles here. And, you know, the action of the upper trap is to elevate the shoulder or lift up your shoulder blade, right? That's what we don't want. Right, so oftentimes the upper trap is really tight and kind of hyper engaged. So if that muscle is working too hard, you're always going to be doing this. It's going to be a slight little lift, which is going to throw off your mechanics. So even just doing a nice little stretch to the side like this, you know, you go to the other side, you'll feel that stretch through that muscle. You know, that can go a long way just to help reduce some of that tension.
Questions, anyone?
Balance, front and back. You're pulling, like swimming,
Mhm.
building all this, your back also, but this dominates over the back.
Yep.
You guys work on balancing muscles, or you try to equalize everything.
Absolutely, absolutely. I would say like this area is probably one of the least trained areas for most of us, you know, even in the athletic population. So yeah, balance is incredibly important, and that doesn't mean you need to be, you know, pulling as much as you push if you're a swimmer, you know, because I'd say you probably should be able to push a little bit more, but the entire system has to work well. Absolutely.
Yeah.
So yeah, great question.
Well, I was going to a physical therapist who said on the next stretches I should go like pull down like that,
Mhm.
down there,
Yep.
versus you're going sideways. What do you think?
Well, it's very person specific, of course, because they're targeting different muscles.
Okay.
Yeah, specific to you and what
Well,
you
it
have
wasn't
going
specific
on.
to me. She had it written up
Oh,
on her.
written up sheet.
Yeah, so
Okay.
it's sharp as steel.
Okay.
Yeah.
Well, it should have been specific to you, first of all.
Oh.
but it's fine. But yeah, you know, that's just working on different muscles. And most of us are, you know, everyone here seems incredibly intelligent. You've asked some wonderful questions. You guys have probably looked up on YouTube. You guys can probably like do this kind of stuff, you know,
Yeah.
at home. It's about what's that next level and what's that next layer for you guys.
Yeah.
If I'm correct in that, you know, I mean, everyone's done this at some point in their life. And it is probably retraining a lot of the specific muscles that you have going on. But there's not one better than the other.
Yeah. Anyone else? Any other questions? Yeah.
Thoughts on physical therapy in combination with prolotherapy or RPK or stem cell treatment?
Yeah. We have a decent amount of clients who are doing it in conjunction. Yeah, we think certain areas of the body, it's incredibly effective. Incredibly effective, actually, in conjunction. Yeah, I don't know, Kevin, if you have any more, you know.
Yeah.
insight
Yeah.
into that.
I would just say still with the prolotherapy and, you know, PRP and all that kind of stuff, you know, it's new and exciting. They still need to do a lot of research. You know, like you mentioned, it's working well in some areas and not in other areas. Kind of depends on, they're trying to find good markers for, which patients, which person it's going to benefit the most. But I always recommend in doing some prolotherapy or any sort of injections that you do the subsequent physical therapy, because it's not like a one and done kind of deal. Even if it feels a little bit better, you want to still fix these mechanical issues and other things.
It's
So
palliative at the end of the day,
Yeah.
right? Gives you some relief, so that you can fix what's actually going on. Great, that's another great question. You guys ask wonderful questions. I love it. Cool. So yeah, what else can be done? Do you want to touch briefly?
Yeah. So again, kind of just talking about what else can be done in regards to the shoulder, and we like to think we can fix everybody, but we can't fix everybody, right? So we do our best, and in physical therapy, we're going to try to correct all these kind of things as far as impingement, mechanics, fixing those mobility deficits, fixing the strengthening or the weaknesses that you have. And I know a lot of you have, I'm sure, tried a lot of these things, even looking up on YouTube or gone to physical therapy in the past. So what else can be done? I don't know if anyone has questions about, rotator cuff repairs or what that looks like. Has anyone in here had a rotator cuff repair? See one there. See one there.
All right, you've had one already?
Yeah. So obviously that's kind of last resort for us, right? But some tears can only be fixed with surgery and doing the rehab afterwards. And typically, even with a smaller or moderate sized tear, we're looking at about 6 to 10 months of recovery time. Okay. Yeah. So it takes a while to get back to doing certain activities like golf and tennis and pickleball. And for some of the people who are in here who've had the surgery, I'm sure I can tell you, it is a process and it takes time to heal. So, any questions about that?
So the question that I have is, how much, you provided some ideas about self-medication, self-healing, sort of make adjustments.
Mm-hmm.
How do I figure out, when do I figure out, how do I figure out when that's not enough? And I need to either see a surgeon or see you guys, something. So how do I, what do I look for to say, I'm not getting anywhere, it's getting worse, or what kind of indicators are there to say I need help, whether it's PT or surgeon or whatever? How do I figure that out?
Yeah. So I always say the sooner the better, right? So if you have any nagging pain in your shoulder, and you've tried some of these things, stretch it out, looking up some of these exercises, it's not getting better, don't hesitate to pick up the phone. We might be a little biased. My first call would be to a physical therapist, because a lot of times, you have to go see your primary care physician, then he's going to send you to an orthopedist. You're going to have to wait a month or two to get that appointment with your orthopedist. So, we do have direct access in California as physical therapists. So, I always recommend calling your physical therapist, because usually you can get in pretty quick. We like to try to offer, next day appointments if we can accommodate that. And if it's something serious, we have, connections and we know who to send you to otherwise. So I would just say, don't let these things kind of drag down the road. Don't let them keep nagging. Pick up the phone and get evaluated and get going in the right direction.
Absolutely.
What insurance do you guys take?
That's a great question. We are in network with Medicare, and we do work with most PPO insurances. But we can kind of talk a little bit more about that once we're all done, kind of finished up here.
Yeah. Yeah. Absolutely.
You guys analyze a person's diet, medications that's causing inflammation in the joints, dehydration, and too much toxins in the body. You guys get into that a little bit too?
Yeah, we do a little bit. We'll definitely tell based off joint mobilizations when we're working on you how dehydrated your skin is. That's the first telltale sign. We also take a full list and a full history because we are a one-on-one physical therapy clinic. So you're with the doctor of physical therapy, either myself or Kevin, for the entire time. We take a full medical history and really figure out, well, could it be some medication interactions? You know, we don't get into pharmacology, of course, but if someone's been dosing Advil 500 milligrams for the past 3 years, you know, every day, we, you know, can give some guidance as to, you know, what they should talk to their medical doctor about.
Yeah.
But nutrition and all that kind of stuff, it plays into everything, right?
Yeah.
And health is made in the kitchen, as they say.
And we like
That's
to
great.
keep, you know, we do have an incredible network just of professionals, nutritionists, and wellness and health coaches, and, you know, chiropractors. So we always like to keep a list of people that we trust and we know. So if we do find they're like, oh, you know, maybe this guy needs a little bit more of a whole like nutrition meal planning type thing, you know, I certainly, that's not my specialty, right? My specialty is the orthopedic and the physical therapy. So we like to, you know, send off to the right people.
Exactly. Yeah, you got that injury. You've been going on YouTube trying to do the stretches, this, that, and the other. You've plateaued. Nothing's getting better. Do you think you can keep exercising away? Do you think you can just keep doing what you're doing and expect a different result?
You guys on YouTube?
We are, actually. So maybe we can find some different stuff from us on YouTube than what you've been watching. But ideally, probably not, right? You know, everyone here is intelligent and knows that. And so, you know, it's really important, as Kevin said, you just to do something about it, whether it's here, there, wherever, Sharp, Scripps, like whatever, just start making a change, interject and break the cycle, okay? This is what everyone expects for recovery. This is how recovery really is. We have a client here who can attest to that. There's ups and downs. It just is what it is. That's how the body works. Okay, but in order for us to mitigate that as best as possible, next slide. We have a process at Auto-Ness Physical Therapy. Recover, restore, advance. Okay, so at the evaluation, we go over, you know, we do all the poking and prodding and stuff, but we also try to establish some goals. Why do people typically see us as physical therapists? Well, Matthew, this hurts, and make it not hurt anymore, right? Okay, cool, we can do that. That's that recovery phase. We have some goals to establish. But how do we know we're getting better? You know, because I can say, oh, your range of motion, you know, was 160, now it's 175. You're amazing, you're improved. But if you're not feeling that, who cares, right? I mean, has anyone been through something like that before? Yeah, you're getting so much better. It's like, I still can't do the things I need to do. And so that's when we get to, you know, the restorative phase. That's how we're correcting all of the movement faults, not just the neck, not just the shoulder, not just this part of the shoulder, but the whole system. How tight is your upper back, et cetera, et cetera. Okay, and then the advancement phase, how do we get someone back to pickleball? Looking at you, Hans. We've been working with Hans for a long time, and we are, you know, still valiantly trying to get him back to the activities that he loves. And had a rotator, if you don't mind me saying, I already asked permission earlier, just saying in public. You know, rotator cuff repair, and you know, it's been a long process, but our goal is to still get him back there, not to 85%, but to 110% if his body's willing. Okay. You know, we've made a huge impact, you know, with those people we've seen so far in Scripps Ranch, and we're so blessed and happy to be able to be here with you guys. You know, our goal is to eradicate musculoskeletal pain in Scripps Ranch. I know it's a lofty goal, you know, but, you know, we do it one person at a time, and we try our best, okay? Thank you all. Thank you all.